Hi everyone, welcome back to our channel. Ever wonder if dementia is just a part of getting older, or if we can do something to keep our brains healthy and sharp as we age? Dementia isn't one single illness, it's actually a broad term that encompasses a variety of conditions. These conditions affect our memory, thinking, and how we interact with people around us. They can be quite challenging for both the person affected and their loved ones. Alzheimer's is the most common type of dementia, but there are others like vascular dementia, Lewy body dementia, and frontotemporal dementia. Each type has its own unique characteristics and challenges. The older we get, the higher the risk of getting these conditions. But there's good news. We can take steps to reduce our risk. Studies show that maybe even half of all dementia cases could be prevented by changing our lifestyles and being more aware of our health choices. In this video, we'll talk about 14 science-backed secrets to help protect your brain and maybe even lower your risk of dementia. These tips are easy to incorporate into your daily routine. Before we start, please give this video a thumbs up and subscribe to our channel for more helpful health tips every day. Your support helps us create more content to keep you informed and healthy. So you might be thinking, what does going to school have to do with dementia? Well, it turns out quite a lot, actually. Studies have shown a fascinating connection between lifelong learning and a reduced risk of memory problems and cognitive decline. Engaging your brain with new activities, skills, and experiences acts like a workout for your brain cells, keeping them active and healthy. This mental exercise helps build something called cognitive reserve, which is essentially a backup system for your brain's functionality. If your brain experiences damage or undergoes changes as you age, having this cognitive reserve allows it to adapt and continue functioning effectively. Consider taking a class, learning a new language, or picking up a musical instrument. These activities can significantly boost your brain health. Even engaging in brain training games and puzzles can make a big difference in maintaining cognitive function. Remember, it's never too late to start learning and keep your brain in top shape. Every new piece of knowledge or skill you acquire helps protect your brain. Hearing loss is more common than you think, especially as we get older. Not treating hearing loss can make memory problems and dementia more likely. When you can't hear well, your brain has to work harder to understand sounds, and that can be tiring over time. If you're having trouble hearing, get it checked out. Hearing aids and other devices aren't just about hearing better, they're about protecting your brain. High blood pressure or hypertension is a big risk factor for dementia, particularly vascular dementia and Alzheimer's disease. This connection arises from the chronic damage that high blood pressure causes to blood vessels. It weakens and stiffens blood vessel walls, reducing blood flow to the brain. This deprives your brain of the oxygen and nutrients it needs to keep neurons healthy. It also raises the risk of strokes and mini-strokes, which can damage key brain areas responsible for memory and cognitive function. Hypertension plays a major role in the formation of white matter lesions. This means damage to the brain's connective tissues that disrupt communication between regions. These lesions are strongly linked to cognitive decline, and that's not all. High blood pressure can speed up the buildup of beta amyloid plaques, one of the hallmarks of Alzheimer's disease, by impairing the brain's ability to clear these toxic proteins. Chronic hypertension is also tied to brain atrophy, especially in the hippocampus, the area vital for memory, and it weakens the blood-brain barrier, allowing harmful substances to infiltrate the brain, leading to inflammation and oxidative stress. The good news is that high blood pressure can be managed with lifestyle changes and medicine. By maintaining healthy blood pressure through lifestyle changes and medication, individuals can protect their brain health, reduce the risk of dementia, and support long-term cognitive function. Remember, a healthy heart means a healthy brain. We all know smoking is bad for us, but it's especially bad for our brains. Smoking makes memory problems worse faster and makes it much more likely you'll get dementia, including Alzheimer's. The bad stuff in cigarettes hurts blood vessels, causes swelling, and makes harmful things build up in the brain. Quitting smoking, no matter how long you've smoked, is a great thing for your brain. Just a few years after quitting, your risk of dementia starts to go down. Quitting is one of the best things you can do for your brain and your whole body. BMI, or body mass index, uses your height and weight to figure out your body fat. A healthy BMI is really important for your brain. Being overweight, especially in middle age, can make you more likely to get dementia later. Too much body fat can cause swelling, problems with insulin, and other changes that can hurt brain cells. Losing even a little weight, like 5 to 10%, can make your body work better and maybe lower your dementia risk. Eat healthy, exercise regularly, and talk to your doctor for advice. If you're finding this video informative, please kindly show your support by hitting the like button and subscribing to our channel so you never miss out on our latest videos. Depression is more than just feeling sad. It's a complex condition that affects many aspects of your life. It's a real illness that can affect your mind and body, including your brain. The impact of depression goes beyond emotions. It can change the way your brain functions. Studies show a link between depression, especially if it's not treated, and a higher risk of dementia. This connection highlights the importance of addressing mental health issues early. One idea is that the stress hormone cortisol, which is high in people with depression, can be bad for the hippocampus, the part of the brain that helps with memory. High cortisol levels can lead to memory problems and cognitive decline. Another idea is that swelling in the brain, which happens with depression, might hurt brain cells. This inflammation can disrupt normal brain function and contribute to the symptoms of depression. Getting help for depression is very important for both your mental and brain health. Effective treatment can reduce symptoms and improve overall well-being. Talk to someone if you're struggling. Reaching out for support is a crucial step towards recovery and maintaining a healthy mind and body. Exercise is good for our bodies and our brains. Regular exercise can protect against memory problems and dementia. It increases blood flow to the brain, bringing oxygen and nutrients to brain cells. Studies show exercise can even help grow new brain cells, especially in the hippocampus, the memory part of the brain. Try to get at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise each week. Diabetes is a problem with how your body uses sugar. It's a growing problem around the world. Diabetes isn't just a risk factor for heart problems, but also for memory problems and dementia. High blood sugar can damage blood vessels everywhere, including the brain. This can lead to less blood flow to the brain, meaning brain cells don't get what they need. Managing diabetes is super important for protecting your brain. While a little alcohol might be okay, too much can be really bad for your brain. Alcohol messes with how the brain communicates, affecting mood, sleep, coordination, and thinking. Drinking a lot for a long time can actually shrink the brain, especially the frontal lobe, which is important for planning and making decisions. Alcohol misuse can also lead to not getting enough nutrients, especially thiamine, which can cause a type of brain damage called Wernicke-Korsakoff syndrome. This causes serious memory problems as well as confusion and trouble moving. Our brains are extremely delicate. Protecting them from injury is really important for keeping them working well. Even mild head injuries can have long-term effects, increasing the risk of dementia later in life. A sudden jolt or impact to the head can cause bruising, bleeding, and damage to nerve fibers. Always wear a helmet when doing things that could hurt your head, like biking, skiing, or playing contact sports. Make sure your home is safe to prevent falls, especially if you're at risk of falling. Pollution is bad for the environment and our health, especially our brains. Breathing polluted air, especially tiny particles, has been linked to memory problems and dementia. These tiny particles can get past the blood-brain barrier, which is like a shield that protects the brain. Once inside the brain, these pollutants can cause swelling, stress, and damage to brain cells. These pollutants also contribute to vascular dysfunction, reducing blood flow to the brain and increasing the risk of strokes and white matter damage, both of which are associated with cognitive decline. Try to avoid areas with lots of traffic, use air purifiers at home, and support cleaner air policies. People are social, and having good relationships is important for our happiness and our brains. Studies show that people who are socially active have a lower chance of memory problems and dementia. Social interaction keeps our minds active, lowers stress, and makes us feel like we belong. All good things for our brains. Make an effort to stay connected with friends and family, join groups, and do things with other people. Social connections are important for a healthy brain. Cholesterol gets a bad name, but our bodies need it. But not all cholesterol is the same. LDL cholesterol, the bad kind, can build up in our arteries and block blood flow. Keep your cholesterol healthy by eating a balanced diet, low in saturated and trans fats, exercising regularly, and taking medicine if your doctor says you need it. Losing your vision, especially age-related macular degeneration and cataracts, has been linked to a higher risk of memory problems and dementia. Vision loss can make people feel isolated and less likely to do stimulating activities, both risk factors for dementia. Some scientists think the same things that damage blood vessels in the eyes, like swelling and stress, might also damage the brain. Get your eyes checked regularly, manage any eye problems, and protect your eyes by wearing sunglasses and not smoking. We've talked about a lot today. 14 ways to keep your brain healthy and lower your risk of dementia. Do you know anyone who has dementia? Are you already doing any of these tips? Tell us in the comments below. The good news is we can change many of these risk factors. By taking care of our brains today, we can have a better chance of having a sharp mind and a brighter future. If you like this video, give it a thumbs up and subscribe to our channel for more daily health tips to help you live your healthiest life.